Cancer is a large group of diseases that can start in almost any organ or tissue of the body, where abnormal cells grow uncontrollably, go beyond their usual boundaries to invade adjoining parts of the body, and or spread to other organs. The latter process is called metastasizing and is a major cause of death from cancer. Cancer is the second leading cause of death globally, accounting for an estimated 9.6 million deaths, or 1 in 6 deaths in 2018. Lung, prostate, colorectal, stomach, and liver cancer are the most common types of cancer in men, while breast, colorectal, lung, cervical, and thyroid cancer are the most common among women. World Cancer Day, observed annually on February 4th, serves as a global platform to raise awareness, inspire action, and unite people in the fight against cancer. In 2024, the significance of this day is underscored by advancement in cancer research, evolving treatment modalities, and the ongoing challenges faced in the battle against this pervasive disease. The theme for World Cancer Day 2024 is Collaborate for a Cancer-Free World. This theme emphasizes the importance of collective efforts from individuals, communities, governments, and organizations worldwide to create a united front against cancer. Collaboration is pivotal in addressing the multifaceted challenges posed by cancer, ranging from prevention and early detection to innovative treatments and supportive care.
I started my training over a decade ago, and I must say that the number of patients that we're seeing in the oncology center at the National Hospital has increased in the last decade. We think that it's due to an increase in the awareness. More people are now aware about the symptoms of cancer and are presenting to hospital, but there's also an increase in the incidence of cancer cases in Nigeria. In Nigeria now, over 100,000 new cancer cases are diagnosed per year. However, what is more worrying about this is that we have almost 80,000 of them dying from the cancer. So we have to do a whole lot to try to reduce the incidence. And then even if it is present, the patients, we advise them to come early to the hospitals so that this would increase their chances of surviving the cancer.
My journey so far in oncology, nursing, cancer care, taking care of a patient started in 2010 when I was a clinical nurse. Then thereafter, I went into the education aspect of oncology. Taking care of cancer patients can be very, very demoralizing. It is, in fact, it takes by the grace of God for the few of us who took it upon ourselves to be oncology nurses to take care of this cancer patient. Breaking bad news can be so depressing and can be so depressing. We've been training nurses. We've trained about 280 oncology nurses so far who takes care of cancer. They do more of preventive cancer awareness. They talk to people, patients, those who are not even affected with cancer, so that they won't come down with cancer disease. They've been educating them. We've been going for screening, breast cancer, clinical breast cancer examination, cervical cancer screening.
So I think this is the last year about closing the care gap, and the theme for World Cancer Day, Closing the Care Gap, has been on in the last 3 years, and this year is to involve the government, stakeholders, and work with them to try to reduce cancer and close the care gap. So many people are increasing awareness, providing treatment, providing support for survivors, everything, the different gaps that are available in the cancer care journey, and you find a way to close that gap. Because we say where you live shouldn't determine if you live or die with cancer. So despite the fact that you're in a low middle income country, treatment should be available like you are in the high income countries, so that the chances of you surviving will be higher. Thank you.
The year 2024 witnessed remarkable strides in cancer research, with breakthroughs in precision medicine, immunotherapy, and artificial intelligence applications. Precision medicine tailors treatment approaches based on an individual's genetic makeup, leading to more personalized and effective therapies. Immunotherapy continues to gain prominence, harnessing the body's immune system to target and destroy cancer cells. Additionally, AI applications in cancer research enhance early detection, streamline diagnostics, and improve treatment outcomes. Despite progress, cancer remains a leading cause of morbidity and mortality worldwide. The World Health Organization estimates a rise in cancer cases globally, with particular concerns in low and middle income countries, where access to healthcare resources may be limited. Early detection, preventive measures, and equitable access to treatment are critical in addressing these disparities.
So in Nigeria, as a low-income country, finance is a very big breaker. Most of the patients who haven't been able to eat would rarely come to the hospital to spend the money that they don't have to feed to use to come to the hospital for a check. So we generally have Nigerians who are very poor health-seeking behavior. They don't come to the hospital until, it's really late. I'll tell you that 70 to 80% of the cases that we see come in late stages, stage 3 and stage 4, which we must work hard to change the current picture as it is, so that we can start having patients presenting in stage 1 and 2. So this is where the awareness, is helping, so that patients know if you find something in your body or something, just listen to your body a whole lot more. And when something is different, present to the hospitals, so that it would increase the chances of you being diagnosed early. Okay, so when it comes to occupational risk factors, environmental pollution, we have to, as a country, look forward to reducing our pollution within the air. Those air pollutants, people are breathing them in, and it could be responsible for the marked increase in cancer cases that we're having in Nigeria now. But for occupational, we need to also advise people who are working in jobs where these carcinogens they are being exposed to these carcinogens, so that they would take extra caution to prevent, themselves or protect themselves from these carcinogens. So, for instance, for lung cancer, we have a particular type of lung cancer that asbestos is a risk factor. So, but all the old houses that were built in Nigeria were using asbestos as the roofing agent. So it will be important for us to find a way to eradicate asbestos and people to, if possible, change their roofing agents, as this, would definitely help reduce the incidence or the prevalence of that lung cancer. So for genetics, we would say like 10 to 20% of patients with cancer is usually genetic, but most of the cancers that are genetic, things like breast cancer, ovarian cancer, prostate cancer, they have genes that, breast, ovarian genes that if you screen for them. So what we advocate for is, if a patient, for instance, comes with breast cancer, we should, or a very young patient with a certain type of breast cancer, we should screen to see if she developed this breast cancer because she has what we call the BRCA or the BRCA gene. Now, if she tests positive, as in if she has the gene, then it's important for her family members for her to screen her children to know, did she pass on this gene to them? And if she did pass on this gene, then those children need to be more aware that they have a higher chance of developing any breast cancer or any of the BRCA-related cancers. So that's the way we go about it. But the cost of this genetic testing is very expensive currently in Nigeria. It's not even readily available in Nigeria. So most of the centers that do it have to take the samples outside the country to do it. So it's difficult to say we want to screen when the cost is coming from their pockets.
Empowering patients and their families is a focal point in the fight against cancer. Patient advocacy groups, support networks, and educational initiatives are crucial in providing information, emotional support, and resources. In 2024, the emphasis on patient-centric care is evident, with an increasing focus on holistic well-being, survivorship programs, and psychosocial aspects of the cancer journey.
So it's a battle that I'm fighting every day, Waking up every morning is a miracle for me, so I don't take it for granted. My journey started 2021. I noticed a lump on my right breast, then I felt there were normal lumps. I noticed it then, for some people, but during my period, I'll be able to feel them. Then after my period, if I check there, I won't be able to feel them. So I just felt there were normal lumps and all of that. So it was just there. After 5 months, 6 months, it was still there. So my husband encouraged I go to the hospital and get it checked. I went to the first hospital and the doctor checked and she said, no, it's nothing. I was the one putting fear in my mind, but I know that within me there was something there. So she asked her, no, there's nothing and all of that. So we went back home. Few months later, since that time the lump was just there, very glaring. So I went back to the hospital. We did a scan, a breast ultrasound, and it came out fibroid, pneumonia, I don't know how they call it, but something fibroid that it's usually happen to younger lady from the age of 25 below. So, and the doctor said for some ladies the lumps will disappear, and for some you can do a surgery and all of that. So we went back home. We're like, okay, what can we do and all of that. So, I was just waiting for a miracle. Like, since I heard he said, okay, it will disappear. So I stayed back, I didn't do anything. Like, I didn't go back to the hospital till, the lump was there. It wasn't moving. It wasn't disappearing like the doctor would say. But so we went back to the hospital. At that time, like, we've stayed like maybe 6 months later after the second visit to the hospital. And that was when, we stayed for a long time. And then the lump that I was thinking it was nothing was a cancerous lump. And then I felt my whole world was just, as in that was the end for me. I was very young, I had a lot of, dreams, plenty of things I wanted to do at that time. So the doctor telling me that I have cancer was just like the end for me. So we did, another scan, and I remember when I was, we were doing the scan, and the doctor was asking, "Are you a Christian or a Muslim?" And then, someone is asking that kind of question, you just know that something is off. And I told her that I'm a Christian, and she told me, like, there's nothing God cannot do. So the results is just there, like, doctors give the report and all of that. So there's nothing God cannot do. And immediately I hold on to that. And the result came out, and it was cancerous. And we went to the surgeon, and we showed him and all of that. That was when he was like, okay, you have cancer. And he was trying to look for every word at that moment to, like, okay, calm me down and all of that. So just me then. So I have to call my husband. Like, my husband was at work, and I called him, babe, something is wrong and all of that. And he was trying to calm me down from phone. And he was like, they are calling you, they need to see you and all of that. He came, and the doctor, was trying to talk to us about the whole cancer in itself. And from there, that was when the journey started. That moment the doctor tell you have cancer. For me, that was when the journey started. So he referred us to another hospital, to commence treatment. And we went to the hospital, and the doctor said, okay, you're starting with chemotherapy. And I know a lot of you must have heard a lot about chemo, going through chemo, that it's very deadly, you can kill, I heard a whole lot of things about chemo. So, and in that moment, I wasn't sure if I would just go through with the treatment. And I remember I had friends, colleagues, plenty of people were calling me, giving me other options. And at that moment, my husband just said, okay, let's just go through with this. And we just like, okay, God, just take control, we are not doing it on our own, just come and help us at that. That was the, the decision, the confirmation of what's the promise of God. We said a whole lot of things, God, come and help us and all of that. So immediately what helped me, well, I have to browse. Thank God for social media. I went through, I Google about, breast cancer survival, people that have, been diagnosed with breast cancer and how they were able to survive and all of that. Oftentimes people talk about people that are dead, if you have breast cancer, you're going to die. Oftentimes we hear about the dead part of it. Not talking about, okay, people, we have other survivors that have gone through this and they are alive, they're thriving. So immediately I go through my YouTube, Google, and every platform I know. At that moment, I went there and I saw a whole lot of survivors, people that have gone through the chemo, the whole process of treatment, and they are doing so fine. It's just your mindset, and then if you have God, God will never leave you nor forsake you. We've passed through challenges and all of that, and we just feel God is dead, like God is not with us. God, why is God allowing things like this to happen to us? But things like this happen to us for a reason. It's kind of a phase, and I know it will pass. So immediately, I just got courage from listening to other survivors, other people that have gone through this and they are fine. So that was just the break for me at that moment. So I decided, okay, and thank God for my husband too, because he had a low, plenty of people were like, no, don't go through this route, we have herbal, we have supplements and all of that. But it's like, he said, no, let's just go through this. And that was how we started with the treatment. I did 4 cycles of chemotherapy, and after the 4 cycle, the doctor now said, okay, we are doing surgery. And the surgery was like, I felt they were going to remove the lump, and that was all. And I said, no, we are going to do a mastectomy, like removing the whole breast. You know, and that was just it. You know, for ladies, our breast is very special to us, like very, very important. So telling you that they are going to remove one breast, so at that point, like, God, what happened? Like, why are you allowing this to happen? Because I felt, okay, after the chemo, everything will go down, you know, I don't have to go through that process. So, you know, it took me few weeks for me to even come in terms with the decision of, okay, you know. So even when I met with the surgeon, like it was like 2 or 3 times appointment before I was able to, like, okay, let's do this, because I wasn't sure, like, is this the right decision and all of that. But you know, they gave me my options, and you know, my results, the lump were in a place where they can't just remove the lump, you know, and it explained everything to me and all of that. I said, okay. I went back home. I was just, you know, waiting for a miracle. Even when they scheduled the day for the surgery, I was still waiting for a miracle, like, God, come and do something so that my breast will not be removed. And that lump was still there. And you know, the surgery was another testimony. You know, went through the surgery, like, it was just a miracle for me to wake up, because you know, it was a fight, and God helped me. We did the surgery, and after the surgery, I went back to my doctor and like, okay, we need to do more chemotherapy, like more chemotherapy. You know, chemotherapy have a whole lot of side effects, like, yes, like your hair, everything about your hair is going to pull off. You are going to feel nausea, like, you know, keep vomiting, tiredness. Like at some point I couldn't even walk, like I can't even stand up from where I was sitting to another place, like I need a help. So it was that bad. And then the doctor said that we're going to do more chemotherapy. So at that moment it was just God, because like I'm not sure my strength was enough at that time. So I would just say it's God that was just with me all through the journey. So I went through all the 4, you know, another 4 round of chemotherapy, which makes it 8 cycle of chemotherapy. And I did that, and God was just faithful. You know, treating breast cancer in Nigeria is very expensive. Apart from breast cancer, like any cancer you know of, treating it is very expensive. And there were moments where there was no money anywhere, because the treatment was every three weeks. For some other person, maybe daily, like you have to be taking it every day. And for some, so mine was every three weeks. And that 3 weeks, like we are spending like 300 or more than 300 for every 3 weeks for me. And you know, there was no money anywhere, but you know, God make provisions for us. Even when we felt, okay, how are we going to continue, how are we going to get funds, you know, I have to start begging my friends, like, please come and help me. You know, there was no funds anyway. We have to look for support. You know, that was why at some point I told myself, I'm not going to be silent. Like, this is my story. I don't want someone, okay, when I'm dead and someone will start telling my story. No, I want to, you know, be open about it, to talk about it, because people don't like talking about some certain things. And at that moment I felt, okay, if I didn't speak up, I'm not sure I'll be able to get the help, like, you know, the help from people that I got. So I decided to open up to few friends, few people I felt led to, like, okay, talk about it. And I was able to get some help, and then my husband talked to other people. So that was how we were able to get funds. And then at some point, looking back, and then I'm not trying to like imagine like a young like myself in a village, in a rural area where I can't afford to get this, like to get the funds to treat myself of breast cancer. So it's very, treating breast cancer is very expensive, and then we need a whole lot of help that we need to, getting funds. I know sometimes some people feel if they talk about it, you're going to get stigma. People are going to, like, talk you down, or like, so it's, I feel talking about it will help a lot. So we talked to some persons, and we were able to get the funds. And after then, I did radiotherapy. That is, I did 25 section of radiotherapy after the chemo. So it was a long journey, and I think after radiotherapy, that was like the whole treatment itself. And then I've started going for like a continuous checkup to know how you are feeling generally.
I'm Basen Esther Marza. Well, it's not an easy journey, but with God, everything can be possible. And I do not know, but the journey have not been easy, because I've had, other friends who were going through this journey together. Some did not survive. Friends I knew, people who went through chemotherapy together, people who went through radiotherapy together. So I think I just give all the glory to God. And I will say it once again, I'm a living testimony. What God cannot do does not exist.
Yeah, let me say it's gone. But, even when you are declared cancer free, you still have to keep going to the hospital, still getting yourself checked. You are still going to the hospital every time to get yourself checked. So for now, I'm still in that process where, okay, like before my appointment was every week, then they upgraded it to 3 months. So it's like that's the process. You have to keep, from one state to another to be able to declare that you're free.
Well, just like when I started, I already had a little knowledge about cancer, because I kind of read, and I knew that for ladies, especially when you're of age, you have to cross-examine yourself from time to time. If possible, even run some, tests, some screening tests. Though I never went through any screening tests, I started my journey during the COVID time, when we had to be at home, no going out, and it so happened I noticed I was having kind of heaviness of the breast, and with time I discovered there was kind of a milky discharge, and it got me kind of worried. I examined myself initially, there was no lump, the discharge was there, and I proceeded to the hospital. On getting to the hospital where I was then, they say they don't handle cancer issues, but they have to refer me somewhere else for proper screening before they can ascertain what it was, because as of then there was no lump at all. But I kept on examining myself, because I was concerned that whatsoever it is, the earlier detection, it could be tackled. So I kept on checking the hospital until I had myself going through some tests, and finally it was detected through all the tests that it was cancerous. By this time, after some months before the lump showed up, there was a lump. It wasn't that big that ordinary one would not even be concerned. But the fact that the discharge was there, I was concerned about this little lump that I was feeling. And to my surprise, the discharge that was milky, by the time I noticed the lump, I had a discharge that some openings on the nipples were milky, and there was this particular one that was bloody. It wasn't milky. So it gave me cause for alarm. I went through the screening and it turned out it was cancerous. The journey wasn't easy, especially the chemotherapy. I went through a series of chemotherapy. At a point, I look at myself like a living shadow. During my chemotherapy, it got to an extent, I greeted a neighbor of mine, and she didn't even recognize I was the one talking to her. And I called her son's name, and she was like, "Sorry, do I know you?" I felt, wow, so am I looking that bad? And I felt down somehow. I got home. I wept. I looked myself in the mirror. I was like, God, am I this bad that somebody I know very well for years could not recognize me? I cried. But in the mix of it all, I still knew I had a living God. I thank God because I came out from a home where my dad always put us through, and he always made us understand that whatsoever was beyond your comprehension, your understanding, that you hand it over to God and you hold your peace. And brethren out there, that was exactly what I heard there to me. I heard those words there to me. I heard it strong to me that this is beyond me. It's not in my power. God, I'm handing over to you and I'm holding my peace. And today, I'm happy to be among the survivors. I've had 2 surgeries. I had the first one that had to take off my right breast, and I started having lump in the second one, and I had to beg the doctors to do away with the second one. And now I'm healed, I'm healthy. After my radiotherapy, I'm going about now. Right now, this interview is being done at National Hospital. I'm right now in National Hospital. I came to, see my doctor, and this lovely sister of mine was with the doctor, and the doctor was happy for me. I'm strong, I'm healthy, and I encourage all out there, please, if you're of age, check your body from time to time. No matter how little a sign you might see, please follow it up. With early detection, you can also be a survivor. I'm happy to be here. Though the journey, as I said, if I think through it, I weep because I have lost some good friends I met. Friends I never knew before. I met them in the clinic. I met them through chemotherapy. I met them through radiotherapy. We were going through pains. We were sharing ideas. They are no more today. May all their souls rest in peace. And I pray for those of us that are still living, that the good Lord will perfect his healing upon us. That as we testify to his goodness, that we'll never go back on it. That will give glorious testimonies, will give thanksgiving to him in the land of the living. Thank you.
In creating awareness for cancer, ACNNTV, in collaboration with Project Pink Blue Health and Psychological Center, organized a walk against cancer in Abuja FCT. This work against cancer created awareness for cancer and also educated people on how to treat cancer patients, cancer survivors, and also the treatment of the disease. The ACNN-TV crew had some chats with some of the participants.
My name is Toromade Faderera Mary. I feel jiggy. It's exciting. Like, you know, this kind of thing, what you do to give back to the society, it doesn't take you giving something, you know, financial or something. It's really exciting and it's amazing. I think the government should pay more attention to things like this, things that people genuinely care about. They like see the way people turned up now, not to collect money or anything. You understand? If the government can pay a little more attention, just a little, it's going to go a long way in saving lives and the lives. Yeah. Shun cancer, yes. Nigeria, shun cancer. That's the choke cancer. So that's it. We are doing an awareness walk, you know, for you to know your status, if you have cancer or not. You know, that's it. To kill cancer, even from beginning. You don't have to get sick before you check yourself. That's what they are saying. You can come and check yourself for free. So that's it. Choke cancer this year, please.
God's favor. Feel excited. I'm happy to be part of those educating people. We need to fight the disease so that no one will fall sick again. Abuja, close the care guard.
My name is Nkem Emmanuel Ire. By God's grace, I'm a survivor. I've been a survivor for 15 years, and it's all about, you know, helping to make sure that a lot of people don't go through what we went through. So for me, that's what it's all about. You know, awareness, advocacy, and, you know, getting people not to fear cancer and just to live right.
Hi, my name is Quincy Chidima. I'm the Executive Director of Sisters Bahad Global Initiative. I actually joined this campaign because cancer actually means a lot to me. My grandmother died of cancer, my aunt died of cancer, and it's a great pleasure to actually get people sensitized about this deadly disease. So as much awareness as we can create, I would actually want everyone to do that. I believe that if one person is aware of it, at least their family will be aware of it. If their family is aware of it, society will be aware of it, like that. We should keep spreading the news and telling people how dangerous this can be. And every single person should go and get tested and screened. Please go and get screened. Cancer, you know, they show for face. So please, yes.
Okay, my name is Vivian Odunze. I'm here representing Radio Maria Abuja. And yes, we are partnering with Project Pink Blue to actually project this work of cancer. The awareness is necessary, it's important, it is key, and it's come at the right time, and we wish that more of this awareness is created, because whether we like it or not, cancer is here with us, and the earlier we detect it and, you know, fight it, the better for everyone. And so I'm reaching out to everyone out there. Radio Maria is here saying to you, be a part of this work, be a part of this campaign, and let's beat cancer. Our sisters out there, our brothers out there, go get checked, go get screened, and together we can beat cancer. Thank you.
My name is Ambassador Mustafa Hassan. Choke cancer!
Choke cancer! Together we can choke cancer!
Yeah, I think what's important in this program is very important. It tells us, it keeps us more aware of the fact that cancer is there, and it's something that shouldn't be stigmatized. People should know they are ashamed because they've gotten cancer. or they have cancer. And the thing is that we all need to come together and fight this menace. It can be fought, it can be won. It's not a death sentence the moment one gets it, as long as there's early screening. And part of the things this program is saying that let's keep checking, let's keep screening, let's stay on top, and most importantly, let's stop cancer.
While significant progress has been made, challenges persist. Access to cancer care, disparities in healthcare infrastructure, and the financial burden of treatments are among the hurdles that demand attention. 2024 presents an opportunity for global leaders, policymakers, and healthcare stakeholders to strategize and implement comprehensive solutions for a more inclusive and accessible cancer care landscape. Nigeria, like many other countries, faces significant challenges in addressing the burden of cancer. Cancer ranks as a major public health concern, with increasing incidence rates and limited access to comprehensive cancer care services. The most prevalent cancers in Nigeria include breast, cervical, prostate, liver, and colorectal cancers. Factors contributing to the rising cancer burden in Nigeria include population growth, aging, lifestyle changes, limited awareness, inadequate healthcare infrastructure, and disparities in access to healthcare services.
Would you say this intervention is working?
It's working, but it's not working fast. We're still behind. We're still crawling. I think we need to do more. We need to do more.
Talking about doing more, in what aspect?
Getting more cancer center, getting us extra radiotherapy machine in National Hospital, because sometimes National Hospital can be very overwhelming with the number of patients that come, because other centers, their machines are always breaking down. Sokoto, Ibadan, Enugu, they usually travel down to Abuja to get cancer treatment. So I think they need to open more cancer centers to ensure that patient gets the best treatment.
In Nigeria, some challenges include 1. Limited awareness and early detection. A lack of awareness about cancer, symptoms, and risk factors often leads to late-stage diagnosis, reducing treatment options and survival rates. 2. Healthcare infrastructure. Nigeria faces challenges in healthcare infrastructure, including a shortage of skilled healthcare professionals, insufficient diagnostic and treatment facilities, and limited access to essential cancer medicines and technologies. 3. Financial constraints. The high cost of cancer treatment places a significant financial burden on patients and their families, limiting access to timely and quality care. 4. Stigma and cultural beliefs. Stigma surrounding cancer and cultural beliefs about its causes and treatments hinder early detection, diagnosis, and treatment-seeking behavior.
Cancer care has actually skyrocketed in the last 1 year. The price of the dollar hasn't helped for the cost of the drugs. But the federal government has an intervention program called the Cancer Health Fund. So for patients who we assess We do a social welfare assessment for them, and they qualify as indigent patient. Then the federal government does support, and National Hospital happens to be one of the 6 centers where this program is available, and you would receive your care here with the federal government paying for services. So yes, lifestyle does, you have one quarter or 1/3 actually of cancers being preventable by modifying, diet, exercise. Obesity is one key factor that plays a role in cancer development. So we would advocate for patients to live a healthier lifestyle, or Nigerians in general, not cancer patients now, Nigerians in general, to have a healthier lifestyle. We will advocate for you to lose weight, exercise, eat right, and stop smoking. All the drinking alcohol, you have to limit it. If possible, it's best to stop it, and all of this would contribute towards a reduction in the incidence of cancer. So that's where the screening comes in. Okay, that's where things like vaccination comes in. So right now the federal government has rolled out a HPV vaccine program to help eradicate cervical cancer. Because HPV, human papilloma virus, is the commonest cause of causative virus in cervical cancer. So if we're able to vaccinate our girls, this would help us reduce the incidence of cervical cancer. So if we do that, then that will at least reduce because cervical cancer is the second commonest cancer in women. I mean, in other countries, it's ranking 4th, 5th place. But in Nigeria, even in some states in Nigeria, cervical cancer is more than breast cancer.
I think it's this oncology nursing program that we started training. It's moving wide because they come from far and near for their training. They come far from north, east, west. By the time they go back and talk to people about cancer. And for a national hospital, as you can see, we have a department, oncology radiotherapy department, that is being dedicated to take care of cancer patients. That's part of their contribution to see cancer prevent the outbreak of cancer being reduced in this environment.
Well, would you say this intervention is working?
It's working, but it's not working fast. We're still behind. We're still crawling. I think we need to do more.
Talking about doing more, in what aspect?
Getting more cancer center, getting us extra radiotherapy machine in National Hospital, because sometimes National Hospital can be very overwhelming with the number of patients that come, because other centers, their machines are always breaking down. Sokoto, Ibadan, Enugu, they usually travel down to Abuja to get cancer treatment. So I think they need to open more cancer centers to ensure that patient gets the best treatment.
Despite the challenges, Nigeria has made strides in addressing the cancer burden and improving cancer services through 1. Awareness campaigns. Various organizations, government agencies, and NGOs conduct awareness campaigns to educate the public about cancer prevention, early detection, and treatment options. 2. Screening programs. Initiatives such as breast and cervical cancer screening programs aim to increase early detection rates and improve outcomes for patients. 3. Capacity building. Efforts to strengthen healthcare infrastructure, enhance cancer treatment facilities, and train healthcare professionals to contribute to improving cancer care services across the country. 4. Policy and advocacy. Advocacy efforts seek to prioritize cancer control on the national health agenda, promote policies for cancer prevention and control, and advocate for increased funding for cancer programs and services. To effectively address the cancer burden in Nigeria, concerted efforts are needed in the following areas. 1. Enhanced prevention and screening. Investing in preventive measures, promoting healthy lifestyles, and expanding screening programs can help detect cancer early and reduce mortality rates. 2. Improved access to treatments. Ensuring equitable access to affordable and quality cancer treatments, including chemotherapy and radiotherapy, and palliative care is essential to improving patient outcomes and reducing disparities. 3. Capacity building and infrastructure development. Continued investment in healthcare infrastructure, workforce training, and technology is crucial to strengthening cancer care services and improving treatment outcomes. 4. Community engagement and education. Engaging communities, empowering patients, and addressing cultural beliefs and stigma surrounding cancer are essential to promoting early detection, treatment adherence, and supportive care.
That's a beautiful question, because I knew my own journey was not easy financially. Fighting it, the drugs, the surgeries, but I had these beautiful sisters. FGGC BIDA, Old Girls Association, thumb up to all of you. You came through for me. I will never ever forget this. And I pray that the good Lord continue to bless you all and replenish you all. For the federal government, please, I would like that if something could be done. I know so many organizations are put out there, but at times, just like the whole country works, things do not get to the right people that should get to. Projects are being put in place. Somebody else sits somewhere and embezzles. People die because the right things have not been done. So if the federal government can do it for us, you can engage even some of us who have fought the cancer. We know where the pain is. We know some of these doctors. We can come around the hospitals. We can see the cases, and we will know who is in need of your financial aids. We're linking up with the doctors. I wouldn't say that you pass money through us. We can fill up the form. Where the fund is, it gets paid straight to the hospitals. But then we know that, yes, the right thing, the person who needs that help have gotten it. But at times, the whole country works in a way that I am being given a job because I know Mr. A, Mr. B. And because I know Mr. A, Mr. B, I feel nothing can be done to me. I do not do what needs to be done. I'm saying this because I know some organizations have been put in place already for such. But I want you to know that actually it do not get to the rightful people it should have gotten to. I know through my chemotherapy, we came for chemotherapy. At times, you do your registration, we had to make contribution among ourselves to support each other. Some people came, they were not able to meet up their drugs, and if you had more or if you had something to assist, we gave it out so that they can meet up for their chemo. The federal government is aware that cancer treatment is not cheap. It's in millions. It drains. So just imagine it there. And some people who have gone through this treatment, some are so weighed down by the chemo, they are not strong any longer. So many people lost their job. and they're out of job. Even those who have survived, some have survived, but they've gone back to zero. The resources is gone. You've survived, then you have to start over from the scratch. So our advice, if the government can come to the aid of helping those who are still in treatment, if possible, something could be done, because even for survivors, there are some survivors out there that will need an assistance. Some are still strong, they're agile, they need a job, they need a place to work, they need where to fix up themselves and have something coming in as a monthly income. Because even at the stage of survivor, I am still on drugs. You continue, the medications are still there. I do not know when I'll stop taking the drugs. So I still know it's not an easy road. The road still continues. Financially, it's not easy. It's an expensive one. Thank you.
I know many people are going through this, like, So what I'm saying is, silence is not just it. You need to reach out to people. Like, reach out to your church members, your friends, and we have NGOs, other non-governmental organizations too that can help. So the main thing is getting to know this organization and reaching out to them. So I think I was able to reach out to some organization that helps me through. So get to reach out to people that can help you. And the main thing is the government is trying, but they're not just, we still need more of their help. Getting cancer drug is very expensive, very, very expensive. Like, I'm taking a drug that, okay, I used to buy it so amount, and few weeks, like when you're going back to get it again, the price is just up. And so federal government should make sure that cancer drugs are affordable. Come up with like a fund where they can assist people that can't even afford treatment. And also talking about equipment like the radiotherapy, PET scan, other equipment that can enhance this treatment to go smoothly. So the federal government should make this equipment and drugs affordable for the patients and people going through this cancer. I'd like to advise you watching me, like you have a friend, a loved one that is going through this. The thing I would say, breast cancer is a thing of the mind. It's your mindset, how you see the situation at that time. So if you can be a little bit positive about the whole situation, and think about what God said concerning you. The Bible says you're going to live and you're not going to die. So affirm God's word. What is God saying about healing? Affirm what the word of God is saying concerning that situation. And I think it will really go a long way. What do you listen to? What do you watch? Those kind of things will affect your mind. If you're listening, if you're watching things that will get you so scared, when you're going through things like this, it will discourage you. So, look for something that is positive, something that, go through like healing scriptures, healing videos about, people that have gone through this. And, it will build up your faith. And that was what happened to me. So, get something that will build up your faith and don't give up. Cancer is just a word, it's not a sentence. Like, the doctors have given their report. But what's God's report concerning this? I think that should be what you should think about at that time.
4 years ago, after my visit, I was diagnosed with colon cancer stage 4. It was my idea that Gloria should tell nobody, because knowing cancer and the treatment, very expensive. I thought if they gave her all the money and let me go and be with Jesus, that will be better. But she couldn't bear the thought of me committing suicide. And I told her it wasn't suicide, it was reality. So I had my coffin ready. I had my order of service for my funeral ready. And only one person knows where the coffin is. The coffin is still there, by the way, up till today. But they conspired. Somehow it leaked and I was ferried to the US. Till tomorrow, I don't know who paid for that treatment. 11 months later, I was cured of cancer. I came back home and started my missionary journeys as I would. Went around Canada, most of the US and UK within 12 months. And last port of call was, as usual, with my friend Bishop Quick, in whose house we stayed for 11 months. And he said, Ben, you've not checked. It's over 1 year now. Can we go and check? And we did. As King James Version will say, lo and behold, they found another cancer on my liver. 40% of my liver was cancerous. Obviously, being on the liver, the death sentence has occurred. So we cried a little bit and we prayed, and I went back home to go and get ready to go home to be with the Lord. My surgeon said no. He would operate on me to reduce the tension that I would suffer in the days ahead. So I said to him, I need to go and tell Gloria this story, and then we'll come back. In 5 days, we were back to the US, and they conducted another surgery on me. They found that 40% of my liver, so all the surgeon did was to cut 45%. The next day after the surgery, the surgeon came and was laughing. And I said, you tore me apart and you're laughing. What's your problem? He said, Ben, I've never seen a surgery like this. This is an ideal surgery, in his words. He said, what he found out was that God had created a boundary for the cancer, and they could not find an avenue, a vascular avenue to travel all over my body. So all he did was to cut 45%. My oncology was not impressed. He said I must take another round of chemo, a concoction of a different type, which he believed he would give to me. And he did. 7.5 months later, we were back home. Exactly 1 year today. In December, I was tested and colonoscopy conducted, and there's not a single cancer in my blood. I have made it a point to give glory to God everywhere I go with this testimony, because cancer is curable. You can fight it. I, for one, am the architect of my own cancer because I love sugar. Believe me, I do. I eat cake of any kind. And once one rebellious cell becomes cancerous, that's what it loves. And being an Angus boy, I love meat. Yes, sir. I love meat. Those are helpers of cancer. But thirdly, when you fear, cancer loves it. Don't be afraid of cancer. God can heal with medicine, and he can heal without medicine. Please let us stand in prayer with those who are going through cancer. Please stand. Dear Father, we stand today with those who are going through cancer, and those who do not know, God, that you heal with medicine and you heal without medicine. This day we call upon you in faith that you will heal. You did it for me, do it for many others, that they may testify. In the name of Jesus.
World Cancer Day 2024 serves as a poignant reminder of the collective responsibility we share in the battle against cancer. The theme, Collaborate for a Cancer-Free World, underscores the importance of unity in facing the challenges ahead. As we reflect on the progress made and the road ahead, the hope is that concerted efforts will lead to a future where cancer is preventable, treatable, and ultimately defeated on a global scale. Our prayers are with all cancer carriers. Where there is life, there is hope. Believe that God can heal you and trust in Him. You will be healed.